And if the patient have a decision release system adjustment, so we have to send the patient to social worker or psychologist, refer to Center of Prenatal Diagnosis, pre-implantation genetic diagnosis of donor insemination, refer to patient organization, or be available to answer the future question. I would like to explain a little bit about the history of genetic counseling. Actually, the genetic counseling is not a very old knowledge, because it found in 1940-41 in Michigan, Minnesota. In 1946, they have already applied it in London, and in 1951, they have about 10 genetic counseling clinics in USA. In Indonesia, since 2005, GC for the first time teach for the first year medical student, Faculty of Medicine, University of Indonesia. How about the clinical genetic diagnosis history? The first chromosomal diagnosis is found in 1956. About 1670s, they have the metabolic diagnosis. About 70s, they have the prenatal diagnosis. 80s, they have the DNA diagnosis. 90s, they have the FISH diagnosis. And in 2000, they have the micro-error diagnosis. What is the ethical rules of doing genetic counseling? You have to do well. You mean you have to know exactly what you are doing, what you are testing. Is mean the beneficence. Yeah, you do non-maleficence. Is mean do no harm. If you don't have to do the prenatal diagnosis, for example, the mother would like to know the disease by prenatal diagnosis, but don't want to do the termination, then not doing the prenatal diagnosis, because even is a very small possibility, about 1%, the prenatal diagnosis could affect on the babies by abort the babies about in 1% patient. And we have to respect for autonomy. It means be non-directive. We don't have to decide it everything for the patient, but patient should be decided for themselves based on your clear explanation. You have to be justice. What is the meaning of justice? You have to give the same information, either the patient is rich or the patient is poor. Yeah, and you have to be trustworthy. This is all the data is confidential. This is the ethical rules of genetic counseling. I would like to see what is, I have already mentioned about eugenics. What is actually eugenics? Eugenics is a study of the agency under social control that improve or impair the racial quality of future generation, either physically or mentally. This is what Sir Francis Galton mentioned. Yeah. What is the difference between eugenics and genetic counseling? Genetic counseling is voluntary, but eugenics is compulsory. Genetic counseling is for patient care, but eugenics for public health. The aim for genetic counseling is informed decision or choice, but the aim of eugenics is reduce morbidity and mortality. I will show you, this is the eugenics performed in Germany during Nazi regime. If you look, they have several propaganda mention the qualitative decline in the population. It will come to this if individual with lesser value have 4 children and those of higher value have 2 children. You know, at first they have the same percentage. After 30 years, the mental retarded patient have higher percentage than the normal person. And after 100 years, all the population will be mental retarded. Yeah, and then this one is other propaganda produced by Reich Propaganda Office, showing the opportunity cost of feeding a person with hereditary disease about 5.5 This is the Dutch mark. Yeah, this is they use this Dutch mark before the euro, like today. The same amount could be enough for a family with 3 children. So all this propaganda make Hitler sign the euthanasia killing for all the person with the hereditary disease. Then also eugenic and genocide. If you remember, if you read about how the Nazi German works, they don't like, or they kill almost all the Semit, yeah, not only the Semit or Jewish, but also for the Afro-Black citizen. Look at this slide. A small number of Afro-Black citizens in Germany, it is a much overlooked tragedy which need to be taught. Hitler forced Afro-German citizens in the Rhineland to turn over their children for forced sterilization. This is what we call it genocides. Yeah. So there is still paradigms where ethical issue would be related to medical genetics. First, research. How about human cloning, stem cell research, decoding human cloning and its implication? What is the risk? About the diagnosis? How about the large-scale screening? How about financial resource? Who pay for that? Social, ethical, and social consequence of diagnosis. Sex determination, confidentiality, insurance, and for management. How about gene therapy? Embryo stem cell transplant. Save your siblings. Do you remember? There's a story about the parents who born another children to save his sister. Yeah, because the sister need the liver donor, and then he get it from the newborn sister. Yeah, newborn babies or the designer babies. So summary, genetic counseling is integral part of the management of patient with genetic disorder. Not only patient but also their families. Yeah, this is the summaries. If you do the genetic counseling elements, then first you have to know how to make the diagnosis. It means you have to know the family history, the physical clinical examination, cytogenetic study, and radiology and laboratory DNA analysis. Means for this, you have to learn about genetic disease, how the disease happen. Yeah, you have to know about gene, how the genes work, how about the chromosome work. Yeah, and then after that you have to estimate the recurrent risk. For this, you have to learn how to make a family pedigree, and you have to learn how to apply various risk calculation method by Bayesian of Mendel. After that, after these two finish, then you have to do the genetic counseling. For this genetic counseling, you have to know the available option, risk calculation. What is the new development? It means if new development, you have to know about the IT. You have to know where to look for, yeah, disease course and treatment availability. And then the patient make a decision based on the knowledge of the disease that you have already give them, and then available option, family pressure, based on family pressure, religious belief, social status, and so on. So if you need more literature, I'll give you 2 literature about which contain the genetic counseling chapter. Yeah. And before I close this lecture, I will give you a homework assignment. This is Dr. and Mrs. Sunarto are from Jakarta. Dr. Sunarto, age 40, is a surgeon, and Mrs. Sunarto, age 38, is a corporate lawyer. They just have their first child and diagnosis as Down syndrome. Please arrange your genetic counseling for this family. Please make your family pedigree at least 3 generations and looking for the possibility of genetic disease in your family. You know, this is 2 homework assignment. The first, you have to make please genetic counseling for this family based on this one. Yeah, the summary. So you have to make genetic counseling based on this pattern. First, reaching accurate diagnosis, estimation recurrent risk, genetic counseling, yeah, this one. And then you have write your assignment, yeah, for Bahasa Indonesia for regular class and English for international class, and collect it before the lecture. Then everybody should prepare for 10 minutes presentation of homework. Why? Because I will randomly choose one of you to present before in the beginning of my lecture. This is the example source test that you can get from the internet. Yeah, for example, genetic counseling, shared decision making and not directive needs in genetic counseling, and also this. Yeah. Finally, we have already finished with the video lecture. Thank you for all attention, and don't forget your assignment. Then I'm looking forward to meet you all in my class lecture. Thank you.